Okay, our next task is going to be to demonstrate to you how to measure and record urinary output. Now, this is important for our students. They need to have a bedpan, and the bedpan needs to have some urine already in it, okay? And of course, this is our school-made urine, okay? They also need to have a graduate, and it's going to be important, if you can see these numbers here, that we help our students understand how to read this, okay? They will have to document what their measurement is, okay? And we also have to have a pair of gloves. Now, this is called like a station, and we can choose to set up stations to help our students at their test site. They could have a station that has a bedside commode, and they could do the rinsing, and then the sinks and everything will be in there together. But I'm just showing you with what our school has. Part of being a nurse, we have to have critical thinking, and we talk to our students about critical thinking. So the first thing we want to do is go ahead. This is not one that they have to do with a actual patient. So therefore, I know before I touch this bedpan, I need to put on clean gloves. So therefore, I'm going to go ahead and put on my clean gloves. Now, I know everyone's having a fit because I've got the bedpan on the bedside table, but let's just act like this is just a station. It's not really someone's bedside. You can put a barrier over it, but they do not have to. For that test site, they don't have to worry about that. Remember, that's the best practice that we're teaching them, but this is for the actual skill learning. It's the skill testing. So therefore, before I touch this, the graduate has to be on a flat surface when I get ready to measure. So actually, the student could go to the toilet and actually rinse it, but they shouldn't be splashing it. If they splash it, they will most likely fail. Okay, now the key thing is to help our students understand how to dispose of the urine. Some students want to pour from this area. That's not the safest way. See here, this is the safest way here, because this is where this part here goes onto the buttocks. This part here is going down below. Now, watch as I pour this out. This will be a much safer way to actually pour. All the urine goes in and there's no splashing. You see that? All right. So now I have the urine on the flat surface. So now what your candidate needs to do is be able to look at this at eye level and be able to determine according to what the readings are here on the graduate, and you can take a look if you will get that. They will go down and be able to see exactly what's there. Once they get that reading, the next thing they should be taught to do is they're going to go and we have to rinse out this bedpan and we have to dispose of the urine. So let's go to the restroom. Now keep in mind, I have my number here already, so I'm walking to the bathroom. And what I'm going to do is dispose of this urine in here into the toilet. Next, and this is a workstation, so I can put the bedpan down. I will next. Now, I'm going to rinse this out here in the sink. But I am not going to dispose of this rinse in the sink because this is urine. So we're going to actually pour it into the toilet. Please stress this process to your students. So many students will come, they will rinse, they will pour it in the sink. No, it goes into the toilet. The next thing I will do is I need to rinse out the bedpan. So I'm going to do the same process. I'm going to get water in here and I'm going to do this process. I'm going to do like this and I'm going to rinse it here, and then they will have a designated area that they have to actually get rid of, put in place, and we're going to use that as our designated area. Then they will take off their gloves just like this, not contaminating myself, dispose of it, wash my hands. Now that I've washed my hands, I have to come back here and I'm going to have to document. So I hope you understand the key point is to make sure that our students realize that they cannot document until they have washed their hands. That's the key point for any of the measurements. So now that I've washed my hands, if you can get a picture here of where there's an evaluator's results and there's the candidate's results. There, the student is going to write here what they have found there, and then the evaluator will write here. So students here, evaluators. That's all they have to fill out on the form. Once they've done that, they can say task complete.